You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, today I chat with Steve Marsden. Steve is a vet, he's a naturopathic physician, he's board certified in Chinese herbal medicine and acupuncture, author of multiple textbooks and articles, and is co-founder of the CIBT. He chats to me about degenerative myelopathy cases and how he treats them. Now, after closely examining his treatments for the past 30 years, he noticed that some cases were responding well, while others were worsening, and he eventually discovered a missing component in his approach that was hindering his success, and started seeing amazing results once he started addressing that problem. So we delve into his insights on this topic. Now, before we head over to the podcast, I want to say a thank you to Lucy from Animal Physio Araki for the shout out about the veterinary rehabilitation podcast on Instagram. Lucy, please email me at megan@onlinepethealth.com for your limited edition veterinary rehabilitation mug. We have the current webinars and our free limited access membership. We've got Diagnosis and Non-Surgical Management of Digit Injuries in Dogs by Jennifer Brown. In our paid membership, 206 hours now of CPD accredited learning. In the hydrotherapy membership, we have got Gait Assessment for Canine Hydrotherapy Patients by Amy Kings. In our paid platform now, 103 hours of hydro-specific learning. And How Tech Influences Movement and Lauren Bergbeck in the Equine Free. In our paid equine platform, 140 hours now of learning with CPD certificates. So you can watch the webinar and with the click of a button, download your CE or CPD certificate. Please take a screenshot, tag at Online Pet Health. Sharing with your audience that you are learning and growing increases your credibility. It makes your clients feel you're on top of your game and that their pets and horses are getting the latest up-to-date treatments. So over to Steve. Hey Steve, thank you so much for joining me.
Oh, my pleasure. Thank you for inviting me.
Steve, for the listeners, won't you tell them a little bit about yourself and you're interested in degenerative myelopathy?
Sure, thank you. I'm a integrative veterinarian, so I have been doing holistic medicine for about 30 years or so. I'm a board certified naturopathic physician. I teach a lot of Chinese medical courses to veterinarians worldwide, and yeah, I guess my main interest as a integrated practitioner would be Chinese medicine. So, lecturing at a lot of conferences, a lot of associations, etc., and trying to take what I observe in practice and apply it to, or help other people apply it in their own clinics. So that's what the circumstances in which I would encounter DM patients was just in the context of that practice. I first got into holistic medicine because I was frustrated by the things I couldn't treat. You may have noticed, and other people may have noticed, that when we get old and when animals get old, they tend to get sore backs, and they tend to get weakness in their lower limbs or hind limbs. So Chinese veterinary medicine as a profession has just assumed that degenerative myelopathy is an example of that it's just a really bad case of it, where the limbs basically are extra weak and the dog can't stand. So it applied, formulas to treat this so-called kidney deficiency, to try to remedy it. So different Chinese herbs, different acupuncture protocols. When I did that, I found they really didn't work, and I didn't really meaningfully impact degenerative myelopathy. And it was only when I started looking at the animals from another perspective that I finally started to make headway. So the new perspective is a perspective that isn't widely taught in Chinese medicine, but it should be. It's an old paradigm. It's actually basically applying their germ theory of disease. So we sort of view modern medicine as having come up with that, but it was Chinese medicine that essentially came up with the first germ theory of disease. And there were sort of three layers or three stages that a pathogen would kind of go through as it entered the body, and the body would react in different ways as this pathogen marched its way into the body. So you're probably familiar with the first stage, which is just, if you get the flu and you get chills and you're cold and you want to heat yourself up, and you might even have a fever, but you don't act hot. That's the first stage. Then the deepest stage is severe inflammation that might manifest as, if you're dealing with an infection, as like high fevers, pounding pulse, you're delirious, you're thrashing around, you're sweating, etc. And so then we want our antimicrobials, our anti-inflammatories. And then there's a middle stage. And in the middle of stage, if you try to treat those animals like you do for the initial stage where you're all cold, what do you want to do when you're all cold? You want to drive circulation to your body periphery. You want to warm yourself up. And in so doing, you end up solving the problem. So an example from a rehab perspective of that initial stage is most disc disease in small dogs. So most disc disease in small dogs, they're not obviously acting all shivery like they've got the flu, but what they do need is circulation driven to their periphery in order to resolve the inflammation that's affecting their spines and the surface of their spinal cord, and to kind of make the whole cord more supple and the column more supple, and to basically just heal the injury. So that's, you take those strategies that were developed for that first stage of illness and say, well, these also work, and they work because they're peripheral circulation drivers. So we don't have dogs with degenerative myelopathy or dogs. Well, actually, we do have rehab cases where we have the other situation, where the fever is high and there's severe inflammation, et cetera. That would be, say, discospondylitis, for example, where there's, a severe infection and inflammation in the spinal column. Okay. So what do you want to do for them? Again, anti-inflammatories, antioxidants, and if it's an infection, antibacterials. But we found that most dogs with degenerative myelopathy, really all dogs, they have a problem with the middle layer between these other two. And the middle layer, they call it the Xiaoyang layer. Not that really matters much for your listeners, but what's important is that how do you treat that? Are you supposed to drive circulation to it because it's kind of the middle layer? Is that the solution? Are you supposed to be anti-inflammatory? Is that the solution because you're right next to the deeper layer? And the answer is both. So you need both influences in order to meaningfully impact a DM dog. You need a strongly antioxidant, anti-inflammatory approach, but you still need to support circulation to the spinal column. So when I looked at the things that we typically do in Chinese veterinary medicine for degenerative myelopathy, we're trying to treat them like a dog with a problem in the outer layer, where we're driving circulation to that cord. Well, that's only half the answer. And without the other half, it turns out, I think, that it's actually detrimental. Degenerative myelopathy, we're used to it just progressing no matter what. So when we don't get results with something, we just assume we didn't meaningfully impact it. But I began to wonder was I actually making some of the animals worse by using this typical approach that people use or think of when they're using acupuncture and herbal medicines. I should probably stop talking and let you speak.
Yeah, it's so interesting. Because these are the type of cases that we get that are just so frustrating because, as you say, some of them, that I've treated and, in my practice, my main thing that I was doing was rehabilitation and acupuncture. And as you say, I used to have some cases that used to just do so well. And then other cases that used to just not do well. And I would feel like, am I actually making this case worse? Because, week by week, they seem to deteriorate. And, maybe, I would make suggestions to all the clients. And, they were changing their food, putting them onto unprocessed foods, to give them antioxidants, some of the clients would do them and others wouldn't. And I wonder now, as you're talking, those ones that were getting better, maybe those are the ones actually that were doing all these other things. But now, in hindsight, I don't know, because I didn't, I didn't have enough cases to actually put it all together and say, okay, I can actually see now where the pattern is. So those cases now that you were originally treating, when you started holistic medicine, you were using herbal remedies and acupuncture. When you started seeing the results, was that when you had sort of realized now there's a nutritional component to treating these cases? And then what were the results once you sort of added in that nutritional supplement component? What are the percentage of your cases that you now started to see improvement compared to that deterioration?
Right. I think nutrition is really important. The original Roger Clemens protocol that he came up with all those years ago, he came up with that back when it was presumed to be an immune-mediated type of pathology that was damaging the spinal cord. So he has his protocol.
Can you tell our listeners about him? Because I remember actually in practice, that was exactly what I used to say. I used to print out a piece of paper somewhere from the internet and say, read this.
Right.
Or everything that you need to know.
I think he's still around. He's a neurologist. And I think he was in Florida at the time that he came up with this protocol based on the biopsy results of a group of affected German shepherds. And when they looked at them histopathologically, they looked at the histopathology, they decided they looked a lot like MS. And MS at the time was considered, even MS was considered to be an immune-mediated type of problem. So he just speculated that therefore things like, things that inhibited fibrinogen and basically things that inhibited inflammation, these things should work. So he went ahead and cobbled together a little protocol and kind of put it out there for people to try. And presumably he tried it himself. And presumably he had some results. So, but whenever I tried that protocol, I didn't feel like I got anywhere. And I feel like probably a lot of people feel the same way. There was actually an independent study of that protocol done in Europe, 12 dogs, and none of them failed to progress. They all kind of went down. The dog that was considerably delayed in terms of their progression, they were on their feet for much longer, belonged to a veterinarian who was also did physio. She was a rehab therapist. And she worked on her dog every day. And so I do think that rehab and physio has an important role to play as well. Even when it doesn't seem to people like it is impacting things, there is an impact. But what Clemens emphasized when he first publicized his approach, which nobody I never saw anybody apply it, was he said the animals needed to be on a fresh food diet. So, that might be the situation in which his protocol finally works, is when they're eating real food. So to understand why would a real food diet work, we have to think about, well, what's the problem? Like, what are we testing for when we do a DM test in dogs? We're looking for whether or not they're positive, whether they have any of the genes for the mutation in a superoxide dismutase 1 enzyme. So that enzyme is an antioxidase. It's basically whenever there's oxidative stress, that enzyme is induced, and it goes there and it tries to quench free radicals and minimize damage due to oxidative stress. That's what it's supposed to do. So in degenerative myelopathy, it's mutated, so it doesn't have that quenching effect. But that's actually not solely the problem. The problem is it also has an excitotoxicity effect, which means that it makes other things, and those other things are toxic. Specifically, there's when we're transmitting from one nerve to another, glutamate is a very important neurotransmitter in the nervous system. But too much of a good thing's a bad thing. And so there are cells called astrocytes that basically gobble up the glutamate. So there's never too much of it being used to transmit a signal from one nerve to another. The mutation in the SOD1 enzyme seems to kill astrocytes, or disable them. So with the astrocytes out of the picture, we have this massive amount of glutamate building up in synapses between two nerves. Well, the glutamate is toxic to the next nerve in line, and it will eventually kill that nerve through a variety of different mechanisms that will damage it and eventually kill it. That's the problem. So how would diet impact that? Well, if you are feeding real food, for example, fresh food, the antioxidant levels in the food are much higher than they are for a processed food like a kibble or a canned diet. So we have an antioxidant effect. The second thing we have is an anti-inflammatory effect. So there's a lot of research going on right now into dry foods about advanced glycation end products, which are so-called AGEs, which are very pro-inflammatory compounds. Well, inflammation produces oxidative stress. And inflammation is a factor, not so much of the spinal cord, but probably the spinal column. That's why these dogs take so long to go down. The first several years of life, you have no idea that the dog's affected. Well, why not? They got the mutation, they got the spinal cord. Why aren't they manifesting it? And it's because it takes several years eating a pro-inflammatory diet for the spinal column to start to degenerate, have issues that then create trauma to the spinal cord. And then if that trauma can't heal, then there's this buildup of oxidative stress from this unresolved inflammation. Superoxide dismutase arrives on the scene, supposed to help, but it doesn't. Instead, it's toxic and starts to impair nerve transmission. And then it precipitates a slow decline. So by feeding a diet, a real food from the get-go, it is, I think, possible that you could actually permanently delay the onset of DM in affected dogs. I actually think that we should be routinely testing, now that it's inexpensive and the owners can do it themselves. We should be routinely testing all dogs that are potentially affected, just to kind of get that out of the way. It's a cheap test. You'll find out if your dog's affected. If they're young and they show no signs, this is when you bring the diet into play. This is when you go to the rehab therapist or the physiotherapist and have them use their tools the way they're used to using them. And you will probably permanently delay the onset of DM because you'll keep the spinal column supple. It won't degenerate. There won't be all that oxidative stress. There won't be an unhealed injury to the cord. You'll be able to at least push those events down the line. So I think we need to stop thinking about degenerative myelopathy as something that we should treat, and we should be looking at it as something we can actually prevent.
Yeah, let's chat about that test. So because years ago, degenerative myelopathy was a diagnosis of exclusion, right? You excluded other conditions which you thought it might be, maybe disc disease, sometimes lumbosacral problems, hip problems. We used to see, and sometimes in those conditions we'd have concurrently with degenerative myelopathy. That used to make it confusing, right? So we diagnose something else, but that could have had degenerative myelopathy together with it. And, in South Africa here, we don't have the test. We have to send the sample over. But I have actually done the test once. And I remember it was in a very young dog, a German Shepherd, and it was diagnosed as having degenerative myelopathy. And I must say, for me, it just didn't present that way. And the owners had found out about the test and said, can we do the test? And I think it's still the same. You do a swab inside the mouth, right? And send the test over. Can we chat about the results that you get, how it's progressed? Because it's probably a lot more advanced than when I did this test. It must have been about 12 years ago that I did the test. So I think it had really just come out. And what, if we had to now do screening tests, because there are obviously specific breeds that we see this so often in, German Shepherds being the one, and I remember seeing a few boxes too with the condition. So how would you see that would work? We'd get a young dog in, test. What are the results that we potentially could get? Because I know that it's not a definitive diagnosis, but it does give you an idea whether they're susceptible. And as you say, if we know that they're susceptible, then we can start changing things in their lives to prevent them or slow down the progression of the disease.
Yeah, I think that's exactly right. I think that's exactly how we would use it. Owners are used to they're doing blood tests on their dogs. They're used to doing fecal, tests to look for worms. So why not just do this to screen them once for degenerative myelopathy? And so what you're looking for are these recessive genes that code for this mutated SOD1 enzyme. And you can either have two recessive genes or you can have one. Certainly, if you have two, you're homozygous recessive for the mutation, then I would just start treating them from that perspective. And even if they were heterozygous, even if they just had one mutation and the other and the gene from the other parent was fine, I would still probably go ahead and be proactive, because to feed your animal a real food diet and to routine physiotherapy and spinal manipulation on them and keep their, to help normalize peripheral blood flow through all the different techniques we have, you're preventing a host of other problems. The same vascular issues that create the tendency to unresolved spinal column disease create cruciate tears. They create the tears in the ligament of the head of the femur that can lead to hip dysplasia. So, the diet will help stave off everything from cancer to heart failure. So it's not as though you're pouring money into something that might never happen, which it's like, to take the steps that are needed, you're going to end up with a much longer lived, more vibrant dog. So, I do think that is a really useful. I haven't heard anyone really advocate that, because I think we just look at DM as kind of like cancer. It's just like bad luck if it shows up, and then you're just trying to slow this progression. And we don't look at cancer as a preventable disease, but we should, because there's lots you can do to prevent cancer. And we don't look at DM as a preventable thing, but it is, because it isn't there for the first half of the animal's life. Clearly something is stopping it from manifesting. And I think it's this age-related accumulation of oxidative stress and damage to tissues that eventually induces enough of the enzyme that we start to, the snowball starts to roll down the hill.
So obviously in best case scenario, you get an owner that has a young dog, hasn't started showing any symptoms. You get them to test. If there is a likelihood that it could get degenerative myelopathy, you start treating them. The second case is the client that comes in and the dog has been diagnosed, or whether it's by exclusion, but the dog comes in with symptoms. What is our approach then to those cases? Is there anything more that we can do besides the physio that we're doing and changing the diet?
Yeah, well, I think that actually that is a watershed moment when an animal starts to show the initial neurological symptoms, that we need to change what we're doing. The diet doesn't need to change. The diet is still always going to be appropriate. But a lot of our physical therapies, our approaches to acupuncture, et cetera, up until that moment in time have probably been about supporting optimal circulation to the spinal column. Really, if we could synopsize it that. And a lot of the ways in which our treatments work, from pulse electromagnetic field therapies to laser therapies to acupuncture, they manipulate blood flow to help to normalize tissues and just keep them supple and keep them strong. The problem is, as soon as an animal is affected with DM clinically, we need to stop doing that. So this is where we come back to that description of the problem from a Chinese point of view as a half in, half out problem, where there's a time when supporting circulation is a really good idea. And there's a time somewhere in there where being very antioxidant, anti-inflammatory is a really good idea. We're at that time when the dog starts to go down. So not completely abandoning supporting normal spinal movement, but being much more cautious. The reason why is because a lot of the if you could look at all the things that we do, acupuncture and PEMF and laser, et cetera, they're really, you can look at them as being dumped into a top of a funnel, and out the bottom of the funnel is how all these things work. And they work very much by inducing an enzyme in the blood vessels called endothelial nitric oxide synthase. It sounds like it makes nitric oxide, and it does. And inside the blood vessel, when you have nitric oxide, well, then you have a very anti-inflammatory effect. And you grow blood vessels and you dilate blood vessels and you really suffuse an area with blood. Sounds like a great idea when you're trying to support the health of a spinal column. The problem is the nitric oxide. Nitric oxide is a free radical. And the body's response to free radicals is to induce this SOD1, this mutated enzyme. It doesn't know it's mutated. It's just, we need SOD1. We got a bunch of nitric oxide here, and we got some damage. So let's get nitric oxide on the scene. The two things together, the accumulation of damage and this continual use of these therapies to increase nitric oxide levels, that's when we start to see the animal decline, and maybe even inadvertently we're accelerating the decline. So we need to antidote that situation. So what are we looking for? And in an ideal situation, first of all, we actually want to get rid of nitric oxide. We want to not create it anymore. So that means changing our physio settings. Generally, when you use physio treatments at a much higher intensity, they become anti-inflammatory. So laser therapy, when you're putting a lot more joules per square centimeter into the dog, that's anti-inflammatory. And electroacupuncture, when you're using much higher frequencies, if you're using electroacupuncture, that's anti-inflammatory. So we need to shift to this anti-inflammatory ice pack type of effect in order to arrest the production of this nitric oxide and the free radicals associated with inflammation that then drive the formation of this mutated enzyme. So we need to do that. If we could directly control the production of SOD1, if we could actually go to the body and say, yeah, don't make so much of that, it's not really helping us, because we don't actually need it. There is another enzyme, SOD2, that's fine. Could use that. So it's not like we're going to die without the activity of SOD1. So if there's a way of lowering that would be awesome. And then the final thing that we want to try to accomplish is we want to somehow reduce this either superabundance of glutamate, or failing that, we want to revive or resuscitate the nerves that are being poisoned by this buildup of glutamate in the synapses. So that's actually becomes the criteria for an effective treatment. So the diet's still important because it's still very antioxidant and very anti-inflammatory. So that's a good thing. The settings of our physical therapy tools, they need to be changed. We need to be looking at it as though we're treating a very acute inflammatory event, not a chronic spinal cord disease. And then the third thing is that, well, gosh, it'd be great if there was a drug to do all this, and there's not. There are drugs on the horizon. For example, this glutamate issue is what is very much behind the declines in ALS in people, which is probably if there's a medical disease affecting people that we can understand DM by, it's probably ALS, not multiple sclerosis. So there's work on drugs to try to limit the poisonous effect of this glutamate. So, but they're not, right now they only extend lifespan in ALS by maybe a month or two. That's so not really that helpful, but still a step in the right direction. Well, the cool thing is there are plants that do all these things. There's a plant called buprenorphine that lowers SOD1 activity, and it's also anti-inflammatory to the spinal cord. And there are other plants like sage and rhubarb growing in people's backyards that actually undo the toxic effects of glutamate on a nervous system. So what we found is that when we put these things together in a bottle, that formula, which we call the DM formula, definitely is slowing down progression and actually in some dogs reversing their symptoms. If they're kind of going down, but they're still capable of, coordinated movement, they're just weak and no longer able to really stand and walk effectively, we're oftentimes able to get those dogs back on their feet on a sustained basis and do it relatively quickly using those herbs.
Sure. So, for some cases, are you basically slowing it down? Some you're halting, and some you're even reversing, because that's not something that I've ever seen, with treatment is actually reversing DM. It's as far as, we've been taught and what we know, it's a progressive disease.
Yes. Yeah, I would agree. And up until this year, I had never seen dogs reverse. The monobupleurum alone, which is that ancient formula for that whole Shaoyang disease pattern that we were talking about, we noticed that it would slow progression, but dogs would still go down and the outcome was still the same. It might just be much more protracted, a decline. But now, most recently this year, treating dogs just in the past, say, 6 months, we've been able to see that some of those dogs will actually reverse their symptoms and they'll become stronger again. If they're very early on in a disease, they definitely and quickly reverse their symptoms. So if they were a little bit ataxic or had some proprioceptive deficits, then those disappear. If they became fatigued on long walks, then they get the ability to go for long walks again. In the case of dogs that are going down, but still have coordination, just lack the strength, we've been able to get those dogs back on their feet. And it doesn't take long. It takes only a couple of weeks. And the game changer were two things. Number one, we took the original recipe for this 2,000-year-old disease and just adjusted the ratios of the compounds in it now that we understood the importance of glutamate and what we were trying to achieve. And the second thing we did was we looked for plants that would work synergistically with that formula that were also glutamate inhibitors. And when we put those in, that's when we started to see the course of the disease start to change. So that's where we're at with that.
So obviously you can't tell us what's in the secret formula.
Oh, I can list the ingredients. The actual ratios are proprietary, but the ingredients are not secret at all. So bupleurum is one. Korean ginseng is important. Salvia or sage and rhubarb or da huang in Chinese medicine. Those are probably 4 heavy hitters in the formula.
And are there any side effects to taking this medication or any contraindications if they're taking any other allopathic meds?
So the interactions, we don't really see interactions with drugs. We don't really see side effects. So we don't really have a reason not to use the formula. I guess a reason not to use it would be that the DM dog didn't have that Chinese medical diagnosis, but they all do. So yeah, it's something that we can just routinely prescribe to DM dogs and not worry about, is this going to be a bad move or not? So it's a very safe formula, despite looking like it's pretty effective. It's the most effective thing I've found, and it's the most, I've never found, in Chinese medicine that you always assume every case is slightly different and you need like a nuanced approach to kind of get results from this patient compared to that patient. However, with DM, I don't find that you need that nuanced approach. It's like they all seem to benefit from this same stuff.
Are there any studies or any plans to do any studies on this formulation?
Yeah, I would love to do a study on it. What we've done so far is, it's one of those situations where you find something that is working and you just want to get it in people's hands. The most what we have done was we did a small little clinical trial at a rehab center in Massachusetts. And she happened to have, Heather Sachs, she happened to have a lot of DM animals, I think about 8 or 10 all at once. So it's perfect. So I just asked her to divide them into 2 groups, that were roughly matched for the degree to which they were affected. And then one group, we gave this new and improved version that has this extra effect against glutamate. And the second group, the original group, we just had them on the original minor bupleurum that we've sort of been advocating for years. And after about a month, Heather contacted me and said, can we just put everybody on, the other one? Because those animals are staying on their feet and some of them are actually seeing their symptoms reverse. So we put all of them onto the new and improved version. And since then, she's had more DM dogs cross her threshold that she's using the formula on. So that's the extent of it in terms of a trial, very informal, but, a large number of dogs at the same time, relatively large considering the disease we're talking about. And it was clear looking at the 2 groups that one group was faring much better. So I think it's definitely the sort of thing we would want to do some sort of trial on.
Yeah. Do you have any completely crazy wow stories that you could tell us of a case study?
Well, so there's one case study where I was giving talking at a conference in Florida a few weeks ago, and I contacted Heather and I said, do you have something with video that I could show the audience? And even then I was just Heather was just saying, this is going really well. And we're having some good outcomes, but she didn't really give me any details. So when I asked her for these, like a case example with video, I was a little taken aback. And, so was the audience, because we start off the before video. First of all, she'd been doing physio zealously for, well over a year. And she didn't feel like she was getting very far with the dog. But again, I think if the typical milestone is they're down at 6 months, then if you can stave off a dog going down until it's 10 months or 12 months, that's progress. So these typical expected milestones, if you can just change the rate at which an animal goes through those, I think you're doing something right. So she was definitely accomplishing that for that hurt dog, but she wasn't satisfied. So she went ahead and started that dog on the DM formula. So he was down at the time she started. She showed a video of him in the living room, and their other dog had the zoomies or whatever, and you could see the shepherd wanted to engage and wanted to play and was kind of doing this, back and forth with its front end, but its back end was just, inactive. But you could also still see in the video that there was some coordinated movement there. It just was incapable of getting up. And the dog by this time was in a wheelchair and was having that kind of support. So just 2 or 3 weeks later, she shows a video of the same dog. So I was a little shocked at the rate of progress. The dog is out of the wheelchair permanently, is back walking, and she showed a long video of him walking down the hall to go to his underwater treadmill activity, and is walking great. He's not like sloppy and staggering. He's just walking. And so that was pretty astounding. And that's an example of one. The first dog we tried the new recipe on belonged to an employee at a pet supply store. And I was just in there one day buying dog food and heard about her dog and said, oh, hey, do you want to test something for me? So I took her a bottle of the herbs for her to try out. And her main symptom, the dog had newly been diagnosed, to the degree that you can, which is just the genetic testing. It'd been newly diagnosed, and her main observation was that he was no longer capable of going on long walks, and afterwards he would be ataxic and weak and sloppy. And so, and again, it didn't take very long. Within a matter of a few weeks, the dog was back up to its full exercise levels and was exhibiting no nervous symptoms whatsoever. So those are just a couple of cases that were compelling, because we're not used to seeing those kind of results to date with their other things that we're doing.
No, not at all. I mean, like I said, even with the physio, and I think there actually are some studies that physiotherapy increases survival time. And that's what we're doing. We're just buying time, right? We're just trying to maintain them, trying to keep them going for as long as we can. So this is really exciting. Steve, where could vet rehabbers that have clients that are looking for this DM formula, where could they get it from?
So they can buy it over the counter. Pet supply stores will stock it, but it's new. So, and the company is new, so it's not like it's everywhere, but you can get it online at goldstandardherbs.com. The website currently serves the United States. In Canada, will be added to it probably within a month. So people will be able to order it directly from the website in Canada. There are people in the UK and in Singapore that are importing it and selling it through their websites. So, the easier it is to get herbs into a country, the more rapidly that people who have web stores could just order the product and sell it directly in those countries. So I don't know what South Africa is like in terms of getting herbs into South Africa, but every country is a little bit different. But if it wasn't that difficult, if it was like sending it to the UK, then it's not necessarily something that has to be difficult to get a hold of.
Yeah, so our listeners are from all over the world. So I think people will have different problems depending where they are. But you said that maybe we could get a discount code.
Yes.
Our listeners. So for those of you that are interested, Steve has organized a discount for the website. So we'll put all that information in the show notes, as well as the links and exactly what the code is that you can use to purchase them.
Right. And it's a tasty powder. So it's a powder, and you don't need very much of it because it's very concentrated. We do encourage people to use real food because it does slow disease progression. And then with real food, it's easy matter just to mix the powder in. You can also shake it up a little broth and just pour it onto the food, the real food diet. So it's fairly easy to get in. It's not a struggle. It doesn't taste bad. And even though the bottles are tiny, they tend to last. So even a big dog is going to get, a couple of weeks out of a bottle, which, 2 bottles, and you should be able to tell if it's doing something for your pet. Dogs that are severely compromised and they really haven't been using their back legs for some time, I don't know what you could expect in terms of any sort of return to function. At that point, as you said, we're just looking at slowing disease progression and stopping the condition from ascending up to involve the thoracics, etc. But for dogs that still have meaningful movement in their back legs, that just no longer have the power or entirely the coordination, I'm guessing a fair number of those could experience a return to strength. It'd be interesting if you had cases and you tried it out, what your experiences were.
Yeah, well, we'll ask the vet rehabbers to give us some feedback, which we'll pass back to you, Steve. So any of the vet rehabbers that try out the DM formula and whatever results you get, we'd love to know.
Yes.
So we'll pass that back to Steve, because obviously the feedback is very valuable for you.
Right. Well, and the website has, as most websites do, it has a testimonials section. So if people can put their experiences with the product online and help steer people towards it, or if they're having a terrible time with it, they can let people know, but kind of help educate others.
Well, I'm very excited about it. It gives hope for those pet owners with degenerative myelopathy, which is not something we really had. We would sort of just try and give them a little bit of hope, but we were always worried, it could be that one that progressed really quickly. So I'm excited about it. Steve, thank you so much. It's been fabulous chatting to you. Thank you for all your knowledge. I've learned a lot today.
Yes, thank you for having me. I really appreciate it.
Awesome, Steve. Take care. Bye-bye.
Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 4th of November. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.